Hey, Dr. Deb Matthew here from the North Carolina Integrative Medical Society. I am really excited to be here today with Dr. Mark Rosenberg, who is an integrative cancer specialist. And I've been listening to him for years at the A4M. He has really exciting information to share with us. He has devoted his career to studying tumor metabolism, and he was the program director for the very first Integrative Cancer Fellowship in the US. He will be joining us in Raleigh at the Southeast Regional Integrative Medicine Conference at the beginning of June. We are so excited to have him here with us today, and he's going to give us a little taste of what he's going to be talking about at the conference.
Thank you, Deb. Thank you for that introduction. There are some exciting things going on in cancer research and cancer treatment. And I will, as Deb said, I'll give you a little teaser on what we're going to talk about. On the diagnostic side, probably one of the greatest areas of improvement is looking at circulating tumor DNA. And to explain a little further, when we get an imaging study, when we get an MRI, we get a CAT scan, that's actually a late finding because it takes approximately 1 million cancer cells to form a 1 millimeter lesion. Now, if we look at DNA from the tumor that's circulating in the bloodstream, well, we can see what's happening well before we see changes on a scan. So we'll actually, in the conference, I will talk about the different assays and different techniques for following what's going on with the cancer treatment. Is the patient responding or not? Or if the patient is at very high risk for recurrence, we can actually see DNA, tumor DNA, circulating in the bloodstream before we see anything on a scan. So we'll certainly talk about that, and again, the different assays that we can use from a diagnostic standpoint. In addition, from the treatment side, we're going to talk about using chemotherapy in a different fashion to actually, believe it or not, turn on an immune response. We call that chemoimmunotherapy. We'll also touch on some repurposed medicines. Many of you may be aware that we're starting to repurpose medicines to use it for oncology. And then at the end, I'll talk about something that I'm working on. I filed a provisional patent about 3.5 months ago. I'm developing a filtration device to eliminate circulating tumor clusters from the bloodstream. If this works as I hope, then we can actually stop the metastatic seeding process. So what we did, my team and I actually joined forces with University of Michigan because they probably do the most research on circulating tumor cells in the country. And we have started our first experiment with University of Michigan. So this is going to be very exciting. And again, I'm excited to speak at this conference. I think it'll be exciting for everybody.
I really appreciate it because, you know, cancer is one of the places where as integrative practitioners, we sort of run up against a lot of, conventional doctors who either disagree with what we do or they don't understand. And sometimes we don't fully understand what they're doing. So it's really nice to have somebody help us bridge the gap. We're really looking forward to having you.
Excellent. Thank you.